In this video we are going to learn about cardiac stress test. In the context of stable angina, a stress test is a diagnostic procedure used to evaluate how well the heart functions during physical activity. It helps assess the blood flow to the heart and identify any potential blockages or abnormalities. To remember the components of a stress test, you can use the mnemonic STRESS. S. Signs and symptoms. The patient's signs and symptoms of angina or other cardiac-related issues are evaluated before and during the stress test. These may include chest pain, shortness of breath, fatigue, or dizziness. T. Testing method. The stress test is usually performed using an exercise treadmill or a pharmacological stress agent like dobutamine or adenosine. The choice of method depends on the patient's ability to exercise and their specific medical condition. R. Risk assessment. The stress test helps assess the patient's risk of future cardiac events by evaluating their heart's response to exercise or stress. It can provide valuable information about the presence and severity of coronary artery disease. E. ECG monitoring. During the stress test, the patient's electrocardiogram, ECG, is continuously monitored to detect any changes in the heart's electrical activity. This allows the healthcare provider to evaluate the heart's response to exercise or stress. S. Stress levels. The stress test aims to increase the patient's heart rate and workload gradually, simulating the stress on the heart during physical activity. The stress levels are adjusted based on the patient's age, fitness level, and medical condition. S. Scoring and interpretation. The stress test results are interpreted by analyzing the patient's symptoms, ECG changes, blood pressure response, and exercise capacity. The overall performance is scored to determine the presence and severity of coronary artery disease or other cardiac abnormalities. Remembering the stress mnemonic can help you recall the key components and purpose of a stress test in the evaluation of stable angina. That is all for today. Thanks for watching. What should we cover next?